Hello everyone, I'm Dr. Siddhika.
I'm Dr. Janaki.
We are consultant psychiatrists from Chennai. Today we're going to talk about anxiety disorders, panic attacks, and panic disorders, and the entire spectrum of anxiety disorders per se. So, Dr. Janaki, do you feel that the word anxiety is being used a lot nowadays?
Yeah, I think even we sort of mistake stress for anxiety, and
Hmm.
people tend to say that I'm having anxiety. We usually use anxiety, even for when we are going into a meeting or we're taking an exam. We say anxiety, but that is a little bit different from what we see in anxiety disorders. This is a
Hmm.
type of anxiety, but we would call it a stress reaction, right?
Hmm.
And when we
Yes.
see it as an anxiety disorder, anxiety is the symptom profile that we see in patients.
Hmm.
And now, especially in this situation, the COVID situation where there's a lockdown, there are lots of people presenting with a mixed spectrum of symptoms, both stress related as well as anxiety. So today we are going to talk about the anxiety disorders which are diagnosed based on the symptom profile that we are seeing nowadays. So
Hmm.
Dr. Siddhika, would you like to elaborate on the symptoms that we are seeing in patients with anxiety disorders?
Yeah, so I think we can divide the symptoms of anxiety disorders into physical symptoms, cognitive symptoms, that is, thoughts a person has when they suffer from anxiety disorders, and behavioral symptoms. So, physical symptoms, it actually you can have symptoms right from head to toe. So, you may have headaches, tension headaches. You may have neck pain, back pain. You may feel giddy. You may have dizziness. You may feel that your mouth is very dry. You may feel that you're sweating a lot. You're having tremors on your hands or feet. You're having palpitations. You may have an uncomfortable sensation in your stomach. You may feel that you have increased acidity, and sometimes even you feel that you have to go to the toilet, but then you may not actually have to urinate. So these are the kind of spectrum of physical symptoms that a person with anxiety may have. And the thing is, these symptoms may not be present throughout the day. It may happen when there is a stressful situation. Sometimes we see that there's a variation. Some patients have these symptoms more in the morning. Some patients have these symptoms more in the evening. Some patients lose sleep because of these symptoms. So these are basically the physical symptoms, and the cognitive symptoms basically are that what a person thinks. So a person may overthink in times of situations like these. They may worry, what is going to happen to me? Am I going to survive this? Is this a very big, major illness that I have? Am I having a heart attack? Am I going to die? If I die, what will happen to my family? So basically, you have a range of thoughts from a mild thought spiraling into a really big thought, which in turn makes you feel very uncomfortable and increases the physical symptoms.
Mhm.
So when you have these symptoms, what happens is you start avoiding going out of the house. You may always want somebody to be around. You may feel very low, very underconfident to be alone. If these symptoms occur before you have, say, an exam, or when you have a particular function to attend, you may feel like, I don't want to go there. I don't want to face these people. I'm not going to perform well, and overall it decreases your functionality or how you perform at work or at school. So these range of symptoms is in different contexts is what we call as anxiety disorders. So Dr. Janki, can you tell us what are the anxiety disorders that we usually see in practice?
Yeah, so there are a range of anxiety disorders we can see. There is a what we call as generalized anxiety disorder. Generalized anxiety disorder means feeling a sense of worry for almost everything that happens in life. So very mundane, normal things in life, like I have to go to work. Oh, I'm feeling anxious about going to work. I'm anxious about sitting at work. I'm anxious about doing work. I'm anxious about eating, I'm anxious about coming back and being with my children. So feeling anxious about all the things throughout the day, and if this continues for a period of more than 6 months, that feeling of unease, being on the edge, continues for more than 6 months, along with other symptoms like loss of weight, or not being able to sleep properly, poor appetite, then we call it as a generalized anxiety disorder. So then the other category will be specific, situational anxiety disorders. So situational anxiety may be like health anxiety disorder, which we are seeing very commonly now, especially with COVID. Or there can be panic disorder, as you told earlier, with a gamut of symptoms happening very quickly. So when it happens as a big attack, a panic attack, and then it subsides, but then it happens again and again. So that is panic disorder. When it happens more than 4 or 5 times a month, we call it as a panic disorder. Then we have other disorders like phobias, like which are for specific things, like phobia, fear of heights, fear of specific closed places, fear of open spaces, claustrophobia, agoraphobia. But we're not going to be talking about that today, because that's a completely separate category. And
Hmm.
then we have OCD, obsessive compulsive disorder, which is also a form of extreme anxiety disorder. Again, we won't be talking much about that today. So we will focus on mainly health anxiety and panic attacks today, panic disorder. So, Dr. Siddhika, can you tell me, like, what is a panic attack and how will a person experience it?
Hmm. So, a panic attack basically can have a stressor, but sometimes it comes even without a stressor. So, what basically happens during a panic attack is a person feels very tense, starts feeling very anxious, and may suddenly feel that he's suffocating, he's breathless, his heart is beating faster, and at that time he feels that I'm going to faint, something is going to happen to me, I'm not feeling very comfortable. So we've
Hmm.
all had this kind of feeling occasionally, like sometimes when we are inside a lift or in a closed space, we may have felt this way, and we may have felt I have to open the window,
Hmm.
so that I can breathe more freely. I have to drink some water so that I feel a little better. So this is what happens during a panic attack. And it comes as a wave, a panic attack. So it comes as a wave, and then over a period of 5 to 10 minutes, it again subsides and you feel normal again. What
Hmm.
happens, but because the experience is extremely scary, a person
Hmm.
becomes scared or anxious that he's going to have a panic attack again. So, for
Yes.
example, if you've had a panic attack in your workplace or when you're traveling, you may then feel that what if I have a panic attack again in my workplace, or what if
Hmm.
I have a panic attack when I'm traveling, and then feel fearful of going into these situations again. So,
Yes.
having 4 to 5 panic attacks a month, and then also a fear of having a panic attack in another situation, is what we call as a panic disorder, and something which we call agoraphobia. So, can you tell me, Dr. Janaki, what should one do if they have a panic attack?
Hmm. Right. So, first of all, having a panic attack, the gamut of symptoms that you've described, one of the most important symptoms here is the psychic symptom, right? Feeling that, something really bad is going to happen to me. So, what happens is the physical symptoms trigger a psychic reaction, that we psychologically we start thinking that something really, really, really horrible is going to happen. I'm going to have a heart attack. I'm going to die. I'm going to become mad. So when that happens, it further triggers worsening of the physical symptoms. So it becomes a vicious circle. So what one needs to know is, first of all, when you we rule out all the organic problems, like we rule out any medical issues. You've already gotten all the tests done. Most people will
Hmm.
come with all the tests done. They would have gone to doctors
Yes.
several times and gotten themselves checked. So then after that, what you do is, when you are having a panic attack, first thing you need to do is, you need to remember this is something that is not catastrophic. It is something that is not going to cause death. It is not going to make you go mad. You are not having a heart attack, right? The symptoms may mimic a heart attack, but it's not a heart attack, because you've already ruled that out, right? So this will pass. As you said, it is a wave. So you know at that moment you imagine that this is a wave of anxiety. It is huge, it is intolerable, it's understandable that you're getting panicky about it. But you need to wait, and you need to let it calm down, right? And you need to say to yourself, it is a panic attack, it will pass, it will pass, right? And we have other techniques of visualization that we will be talking about in a moment, but at that moment you can do that. And if you're having breathing difficulty, then one of the things that is recommended is to use a paper bag, to breathe inside the paper bag, which will help you control the level of carbon dioxide and oxygen, and then it'll stop the cut the panic attack, it'll stop the breathing difficulty, and you will feel more like in control of yourself. So that is, these are some easy ways to cut down a panic attack. But then further, over and above that, we have to look into cognitive behavior strategies that we can use for a panic attack. So Dr. Siddhika, would you like to give us an idea of the cognitive behavior therapy strategies?
So before CBT, basically, I feel that identifying that this is an anxiety disorder, identifying that this is a panic disorder is what is important. So, like you said, we do rule out other medical causes of anxiety and panic. So, some of the common medical causes are, say, a low hemoglobin, having a low blood pressure, or low sugar, and sometimes hyperthyroidism, which can actually mimic these conditions. So sometimes what happens is, of course, when a patient comes to us, they do go to a physician first. They get these checkups done. So one thing in the form of reassurance is that all the tests, if they are normal, we know that it's not because of fluctuations in these physical parameters which is causing the symptoms. So a person can be reassured that even though they are having symptoms, it's not because of these physical parameters. So then, what we basically start off by doing is, in cognitive behavior therapy, the basic premise which we work on is any event which occurs triggers a pattern of thought, and those patterns lead to our emotions. So when anxiety is our emotion that we have, there's a pattern of thought leading to that anxiety whenever an event occurs. This event could be internal or it could be external. So what we do is we find out what is the pattern of thought. We find out what are the what we call as cognitive distortions that a person has. By cognitive distortions, we basically mean maladaptive thinking patterns that are developed, and this could be what we call something as catastrophization. So if I have palpitations, the first thought that I have may be that this is a heart attack. If I have a headache, the first thought I have may be that this is probably cancer. So we know that there's a range of possibilities, that the headache could be just a simple headache, could be just a tension headache. And one of the few, it's probable but not very common, that is actually because of cancer. So when you reach the worst possible outcome immediately, that is what we call as catastrophization. So we identify what are the cognitive distortions, what is the maladaptive thinking pattern that a person has, and underlying that, there's always something what we call as a schema. And the schema is the general pattern of thinking that a person has. So if you feel that if I am not safe, I have to feel safe all the time, that could lead to catastrophization. We identify what exactly is the person's concern, what exactly is the person's concept of like a form of thinking, and then slowly we try to change these, we try to challenge these thoughts, and make changes to so that there is no anxiety. So this is
Mhm.
what we do in cognitive behavior therapy. As far as for the behavior purpose, we also do something called relaxation techniques. We teach breathing techniques. We teach ways in which a person can reduce anxiety may actually differ from person to person. So some people may feel calm just by sitting in one place. Maybe some people feel calm by just opening a window, breathing in fresh air. So doing something like this, which will make you feel better, and identifying that even though I'm panicking, even though I'm having a panic attack, I need to do this so that I feel comfortable faster. This
Mhm.
takes a little bit of effort, and but over time it is possible for a person to do this.
Yeah. Mhm.
Anything you want to add?
Yeah, just with the, the thought process, when one has a thought process where they think that it is a heart attack, or nowadays people are saying that they may be having COVID. They, whenever there is a cough or there is a throat pain or anything, a small cold, they feel that they may be having COVID, and so that leads to a lot of anxiety symptoms, and then it mimics the symptoms of different illnesses. So, and that is what we call as health anxiety. So when that happens and that catastrophization happens, one of the things that you pointed out, that the rarity of the diagnosis that they're thinking of. Maybe now we look at the heart attack example. If you've ruled out everything and it cannot be a heart attack, especially young people, 30-year-olds, then they come with the chest pain because of stress, and then they think that it may be a heart attack. Then we usually we tell them that, think about the logic here, right? Logic it out,
Hmm.
that
Hmm.
okay, you don't have family history of an early heart attack, you have never, smoked, or you have never had drinks, you're a teetotaler, or even if you have, then you have not done it at a dangerous level. And now you are in a situation where, there is stress at work, there is clearly a stressor, and that could lead to anxiety, which is the most probable diagnosis. It is more
Hmm.
likely to be anxiety, and you've had repeated attacks, and still you are, like, you are not as unwell as a person with a heart attack would be, right?
Hmm.
So use this logic at that moment, logic it out to yourself that it is
Hmm.
very rare that this could be a heart attack, and then
Hmm.
say to yourself that, this is an anxiety attack, it will pass. Try to, sit with it, sit with the anxiety, as you said, different people using different mechanisms, but then try to also graph it out, like put a graph for the time versus anxiety, and see the peak anxiety going down. When you draw the graph, at 5 minutes it has gone down 10%, at 10 minutes it has gone down 50%. Then you will see that in the first go it will be 5 minutes, then 10 minutes, maybe 15 minutes it goes away, then the next time it will be 10 minutes. So that visualization of the decrease in the anxiety will give you an idea that this is the way the panic attack decreases, the anxiety decreases, right? And that will give you some reassurance.
Absolutely. And one thing I want to mention about COVID anxiety, that's what people are calling it now, right? COVID
Yeah.
anxiety. So
Hmm.
it's basically that there is a general fear that, if I have a cough, if I have a cold, it's probably COVID. And in one way, it's good to keep a watch. It's good, and first of all, that being anxious at this time is actually protective for us. So if you're
Hmm.
anxious, if you're staying at home, if you're washing your hands, if you're wearing a mask, it's actually a good protective behavior that we need to have in this case. We don't want to be reckless, and we don't want to just go out of the house without taking any precautions, thinking that
Right.
nothing is going to happen to me. So that
Hmm.
amount of anxiety, that amount of fear, which is a real fear, it's a real danger that we are facing right now. So
Hmm.
we require that right now. But on the other hand, what we're basically seeing is patients now rushing to the hospital saying that I want to get checked to see whether this
Hmm.
is COVID. And
Yeah.
so if you don't have a proper pattern of symptoms, if you don't meet the criteria for testing, then the doctors may advise you home quarantine without checking. So what we're basically seeing is patients who do not have the opportunity to get checked because they don't fulfill the criteria, feeling that what if this is COVID, and being anxious when they are in home quarantine.
Yeah.
So the main thing is, if you don't have severe symptoms, the doctor is going to advise you home quarantine, which is actually the treatment that is required. So
Hmm.
having that anxiety that unless I get checked, I'm not going to get the proper treatment is wrong.
Hmm.
So
Correct.
over time, that's what you need to prepare for. I mean, everybody needs to prepare for that. That they need to be in touch with their doctor. They need to have teleconsultations first, and after that only go to the hospital if advised by the doctor. But as far as
Right.
possible, try to quarantine yourself at home, and follow home remedies and whatever the doctor has advised.
Yeah.
Secondly, we also see patients who have recovered from COVID then being
Hmm.
anxious about what if the symptoms recur, what if the
Right.
symptoms come back again. And again, we are actually, we've just been with the disease about 5 to 6 months. So, of course, there's a possibility that you may have the symptoms again. We don't know exactly what the course of the illness is like, but be in touch with your doctor, be in touch with, take the medication, whatever is prescribed to you regularly, and don't be anxious that something is going to happen to me. Look at it
Mm.
positively, say that, you've been like a COVID survivor or a warrior, and you've, survived out of this, and now whatever happens, you'll be able to manage because you've actually done it before.
Mm. Right. That's a very positive thing to say. That's absolutely, absolutely true. So just when you were talking about the reaction, the anxiety response, and you were saying that it is beneficial, I just thought maybe we can also talk about the normal versus abnormal responses, anxiety and fear responses.
Hmm.
So when there is a fear, there is a true, thing to be scared of. Then we call it a
Yes.
fear,
Hmm.
right? And when there is a signal anxiety, as we term it, signal anxiety is something that we all have. When there is an issue or a stress that we are going to face, then we have some anxiety which will actually put us into some action to prevent that stress from happening, prevent that situation from happening. So for example, I have to face an exam tomorrow. If I don't have that basic level of fear and anxiety, I will not study for it. So right, like you positively, correctly put, that if we don't have fear for COVID, we will not take the precautions that are required.
Exactly.
So like that, this is signal anxiety and real fear that should be there. But what happens in anxiety disorder patients is that they have a flight, fright, or fight reaction in situations that are not truly anxiety provoking. That they may be mildly anxiety provoking, but the anxiety reaction is intense. So
Hmm.
when we say flight, fright, or fight reaction, that is the general response that our body has. That either we fly away, like we run away, flight.
Hmm.
Fright is we are really scared and we have symptoms that are associated with being scared, or
Hmm.
we freeze, right? So freezing means we are in shock. So this three triad of response can happen in any normal situation, right? So if this happens when if this happens when there is no real situation, or there's a mild situation and it is very intense, then we call it as an anxiety response, right? And a pathological anxiety response which needs to be treated.
Hmm.
Yeah.
Yeah. So
So
it's basically like, if you've seen these National Geographic videos and you see, a cheetah chasing a deer, you'll
yeah.
initially see that the deer just becomes very still, and then, it raises its ears and tries to listen what is happening exactly. It's frozen in that moment, but it's also seeing what should I do? What should my response be? And then as the cheetah comes closer, the deer just like runs away because the deer knows that I can't face this cheetah, right?
That's right.
And
Hmm.
so it's basically anxiety is evolutionary. It's
Mm.
basically for our protection. But at a point, for example, when you say about an exam, if it becomes so intense that you feel fearful or anxious to actually go for the exam and you
Mm.
avoid going for the exam, or because you're so anxious, you don't do well in the exam.
Mm.
Sometimes with anxiety, your mind can go blank.
Yeah.
You studied, you remember, but you can't put it on paper. So when that happens, or we see some students also who become anxious because there are some issues like bullying in school,
Yes.
or there may be other problems with friends or the teachers, and then they don't want to go to school. So
Mm.
when it becomes like dysfunctional, when we can't do our usual work because of the anxiety, that's also when we call it as an anxiety disorder.
Yes, absolutely. Right. So we talked about the cognitive behavior techniques. Some of the other methods, of course, which people find it hard to accept, is, using medications. But
Hmm.
what happens with anxiety disorders is that, in the beginning, people are so, high strung and so wired that when you sit with them and try to tell them that use these techniques, they will not be able to use it. So we need
Hmm.
to calm their anxiety and calm them down before we can actually use these techniques. So that is why in the beginning of treatment for panic attacks or any kind of anxiety disorder, medications are used, and these medications can be of different types. They can be SOS or as and when required medication, or they can be long term medication if the doctor so thinks that there is a need for long term medication. It can be long term medication, or else it can be a combination of both, which may be required in the beginning of the treatment for anxiety disorders. Dr. Siddhika, would you like to elaborate on that?
Many people are worried again that what one of the things, of course, is uh, especially the relatives would come and tell you that this is so common and a person should be strong enough to deal with anxiety.
Yeah.
You can't keep
Mm,
taking medication for your anxiety. You have to
mm,
overcome it by yourself. And so that's why the differentiation between normal anxiety and an anxiety disorder is important. So when you have
mm,
a diagnosis of an anxiety disorder, then you know that it's not actually in a person's control, and it's too overwhelming for a person to try these techniques by themselves. So
mm,
secondly, about medication, people also feel again worried about how long should I take this medication.
mm,
So, and of course, I always feel that it's basically we do a risk benefit analysis. How are you
mm.
doing with the medication versus how are you doing without the medication?
Yes.
And if there's a medicine which is making you feel better, making you live better, and improving the quality of your life, then why not take the medication?
Mm,
So
that's right.
these are the pros and cons that we need to weigh about taking medication, considering CBT or other behavioral techniques, and
Mm,
basically choosing what works for a particular patient in a particular way.
right. And in terms of prevention of anxiety disorders during this, especially during this period or generally in our lives, of course, we talk about all the healthy living, lifestyle techniques that, you have a balanced work life, and then you do exercise every day. Preferably, you do some yoga, you do meditation, and you do mindfulness techniques. These are all preventive strategies. But if you have to choose one of these, you say, okay, I can't, I have to work a lot. I know I don't have a way that I can balance my work and life. Then one of the things that you must do for an anxiety, especially for a person who is anxiety prone, is to do something that is like yoga, which is, it has been proven that yoga, pranayama, that is breath control techniques, are very effective in preventing panic attacks. And these are many studies, even though our ancient Indians kept saying it for centuries. But now
Hmm.
that the Westerners have done some research on it, now it is said that like they have proven that without doubt, even one 5 minute of pranayama every day, controlled breathing exercise, can actually prevent panic attacks. So if
Hmm.
you have to choose amongst all these strategies, then the best strategy would be to do breath control techniques or pranayama every day if possible, and to do yoga and meditation if possible, to prevent panic attacks.
Yeah, and the basic breathing techniques that we learn, otherwise, deep breathing or pranayama, is basically what we need to utilize when you have a panic attack, so that again
Right.
that CO2 washout doesn't happen. So
Hmm.
you convert the shallow breathing that you have during a panic attack into a deep breathing. So only when
Hmm.
you do it on a usual basis are you going to be able to translate that when you're having a panic attack or feeling extremely anxious.
So, to summarize, today we've talked about different types of anxiety disorders, and we've talked especially about panic attacks, and we've talked about health anxiety. We've talked about how to manage it with CBT and with medications. We've briefly touched upon the treatment strategies, and we've talked about how to prevent panic attacks and to prevent anxiety. So we've omitted talking about OCD because OCD is a topic in itself, and next time we are planning to release a video on how to identify and treat OCD. And so, Dr. Siddhika, you were saying that this video will give the patients an idea of what to expect when they
Yes.
come to a psychiatrist.
Mm.
Can you tell us more about that?
Yeah, so basically, if you've seen this video and you feel that you can identify that you have some of the symptoms, you feel that you relate to the symptoms that we've discussed, then you know that when you go to a doctor, and most of the time when people go to a general practitioner or their family doctor, and then I mean, the most common disorders that we see in practice are anxiety disorders. So
Mm.
when a person goes to their family doctor and they say that, I think you need the help of a psychiatrist, instead of feeling that, oh no, I can't go to a psychiatrist, I'm not crazy, you can just say that, yes, I know that, we'll have these options of all these techniques that we talked about, even medication, to target the anxiety disorder and the panic attacks. And that is why it's an okay option to consider going to a psychiatrist and seeing how things
Mm.
work out, instead of, again, panicking about why is the doctor sending me to a psychiatrist.
Yeah,
So I hope this
absolutely.
video basically resonates with you if you've had these symptoms and you know what to expect the next time you go to a psychiatrist.
Thank you.
Thank you.